Hello, and welcome to Abby Tyler's Healthy Living. My name is Abby Tyler. I'm your host, a family nurse practitioner, a health and wellness blogger, and a community volunteer. In here, we discuss evidence based health information regarding mind, body, and soul with a holistic emphasis. Thanks for joining me on this journey of health and wellness. Please enjoy the show. Hello, ATHLers. Welcome to our Tuesday show, our weekly show. My name is Abby. I'm your Healthy Living NP. And as you can see, today's show we're going to be speaking about antibiotics, do's and don'ts. Okay, as always, I'm a provider, but I'm not your provider. So please do not make any changes to your regimen without checking with your own provider. Okay, please share the show. Please share the show. Please invite others and also share the show. Please give me a thumbs up all through and in the beginning. Alrighty, so let's get into it. How you guys doing? Hope all is well. So antibiotic do's and don'ts, mainly antibiotic safety and the dangers of taking medications that's not prescribed for you and all that. Okay, think about antibiotic too. Unlike other medications, I mean, all the medications are also unsafe if they're not prescribed for you. But antibiotics, they have a more powerful effect. So it's very important that you don't take medications that are prescribed for you. But also, most of the time, too, we having issues when we having like super bugs now, where people are taking medication, they're not taking it completely when they're supposed to, or they're taking medications that are not prescribed for them, or they're taking parts of it and all that. And what happens is you develop super bugs, and more powerful resistance. Organisms that are more resistant to the antibiotics that we already have on hand, so that can also cause community and other health risks and all of that too. So it's important that you follow up and you follow exactly what your prescriber, your doctor, or your provider is prescribing for you, and you complete your medication like you're supposed to. So, and sometimes, all right, so let's start off. Again, please share the show. Please share the show. Okay. So sometimes people may come to go to the doctor's office or to urgent care or an emergency room, and they're saying, I have a cold, I have a really bad cold, and I need an antibiotic. And most people, they'll tell you, no, you don't need an antibiotic because that's a virus. And sometimes some people get mad because there were doctors before that used to prescribe and some, antibiotics or things. And sometimes this is to appease the patient, but it's not always safe, because if you're prescribing that, every time the patient understands that, okay, whenever I get this cold, I get prescribed antibiotic. But you can take something that's not a bacterial. So antibiotic takes care of bacteria. So sometimes, so if you have a common cold and all that, you're asking your doctor for it, they might tell you just go ahead and take something over the counter. Alrighty, so they might give you the medication that we use for I don't like to call it too many medications and all that. So they might give you the medication that we treat for a cold, and it might tell you, buy whatever the cough medicine or whatever it is, put some Vicks. Back home we always put Vicks on everywhere, and take that, drink a lot of fluids, get some rest and all that, because what you have is a common cold. It's not a virus. Alrighty, so you do your best to stay healthy and all that. But let's get started here. Again, please invite others. Welcome to everybody watching Abby Tyler's Healthy Living page, and also from Focus on Liberia, and also from YouTube. Alrighty, so number one, let's go back here and change our banners. Okay, so we put that here. Okay, so I just put ABX for antibiotics, so I don't want to spell it all through. Okay, so take antibiotics only if you need them. Alrighty, so antibiotics only to treat certain things as strep throat, whooping cough, urinary tract infection. That's when you're urinating and it's burning, or you're having other issues. If there's any blood, please make your doctor aware of that. Okay, because you're not supposed to have any blood when you urinate. Outside, if you're on your period and all that too, you shouldn't be receiving any blood when you urinate. Okay. So antibiotic takes care of things like that. Sometimes on lung infections and all, it takes care of things like that. All right. Antibiotics do not work on viruses, like I said, such as cold and runny nose. Even if the mucus is thick and all that, yellow or green, antibiotics not going to do for that. Again, like I said, depending on your other pre-existing conditions and all, your doctor may decide, okay, I'm going to put you on that because you have other issues going on that maybe the antibiotics would help, but most times that is not the case. Okay, so for sore throat, except for strep throat, again, you can get antibiotic for that. for the flu, okay, the influenza, and also for like chest colds and things like that. Some bronchitis too, they might put you on antibiotics, but sometimes it's just something you take over the counter, rinse your mouth with some warm water and all that too. But sometimes, like I said, depending on your pre-existing conditions, if you've been going through this a long time, sometimes they might also say they want to do an x-ray just to make sure nothing else is going on there. And if it's hopefully it's not pneumonia and they need to treat that. Okay, so your doctor would make that determination based on the presenting symptoms and also everything else that goes along with your particular history. Okay, so again, I said antibiotics, you don't need antibiotics for like, cold and all. So you go to your doctor and they say you're not getting that. Some people might say, my other doctor always gave it to me. I had a patient that came in one time and it's like, oh nope, whenever I get this, I go to my doctor's office. He gives me this. So I'm not leaving until I get that. So it's like, okay. And he was determined not to leave until he got that. So again, like I said, sometimes some doctors will appease it and you don't want to seem like you're going against another doctor, what this other doctor did and what the other doctor didn't do, but you have to explain to them, this is what's going on. Okay, fine. Let's go get a chest x-ray. That will make you feel better, just to make sure nothing else is going on there. Okay, but again, like I said, your doctor will treat you according to your what's going on with you. Alrighty, so because some people might say, okay, yeah, I took the antibiotic and took away my cold. Your cold was going to go away regardless. So just taking the antibiotic didn't do anything for that. Okay, just your cold was going to go away and it went away. Alrighty, number 2 there. Take your antibiotics as exactly as prescribed. Okay, so making sure you're taking it exactly, they tell you 3 times a day. Take it 3 times a day. They have to ask you, say every 8 hours, make sure you use every 8 hours in between. Don't just take it 3 times a day because sometimes it works over a period of time. So you need that 8 hour in between. You need it every 6 hours in between. You need it every 12 hour in between. So take it exactly as the way it was prescribed. If you miss a dose, go ahead and take it as soon as possible. You can always call your doctor and see, do I need to take my dose now? Or I just wait for the next dose and then just finish the term, because you want to finish up the entire thing. Okay, do not share antibiotics with others. Do not share it. Do not share it. I know back when we used to we bought it on the street. So it was like right in the open market, which was really dangerous. Okay, so but do not share any antibiotics with anybody else, because that person may be taking other medication that may affect their ability, that may affect them. Okay, so do not share that and interact with the medication, of course, like, some really bad adverse reaction. Okay, so side effects. So please do not share that. Okay, let me just put that there. Alrighty. Do not take any antibiotics prescribed for someone else. So basically what I just said, this may delay the best treatment for you and make you even sicker, because let's say, you're taking the medication and you didn't go to your doctors to get it checked. So, I would just take this one that's left over. And then that means you're not taking the full course of the antibiotics, because most antibiotics is supposed to be for at least 7 to 10 days, sometimes almost 14 days. And sometimes it can be even longer than that, depending on what the illness is. Alrighty. Do not save them for later. Tell your pharmacy if you're done and you're feeling better, you're supposed to take it regardless of whether you're feeling better or not. Okay, but if you have to get rid of it, call your pharmacy. You can call your pharmacy, or you can call your doctor's office and say, how can I safely get rid of this? I don't want to keep that, because remember now, the components in the antibiotic, sometimes over time they kind of degrade, and the potency of the antibiotic too. Also, it can be a little when it like degrades over a period of time, it can be dangerous to use too. So do not keep that. Make sure you dispose of it. Don't keep it for later. Say maybe if I'm feeling better next week, I might continue that. I've had patients also that too, where it's like, oh yeah, well, I'm feeling better last week, and then I stopped taking it, and then later on I started feeling bad again, and so I went back to taking it. You have to take it continuously, okay, until it's completely done. Alrighty. Also, want to make sure you talk to your doctor, your provider, exactly about any kind of side effects. Some antibiotic side effects, it's like, okay, I take that, I get a little bit of rash, and we can probably give you a medication for a little bit of rash, but it could be very serious. It can be from like a little bit of rash, a little bit itching, to like completely to where it lands you in a hospital and almost like to point of death. Alrighty. So tell your doctor. The minor ones would be like a little bit of rash here and there. Maybe you have a little nausea, like when you feel like you want to vomit, and also we can treat that also. Diarrhea, mild diarrhea, where you having your number 2, you go with number 2 maybe a couple of times a day or just a little bit. But if you find yourself going a whole lot and you find it like you get a little different odor from your bowel movement, you definitely want to let it, because sometimes it's called C. diff, and that can cause an infection, and that can also land you in a hospital. You may need additional antibiotic to take care of that too, because what it does is like the antibiotic is working in your body, but it's killing the healthy bacteria that's supposed to be in your colon and all that. So that can cause, infectious stool, and you need to get that checked. Okay. And itching, alrighty, a little itching here and there. Like I said, we can take care of that. But I remember back home we used to take chloroquine for the malaria, and my God, that used to like itch our skin, and it was gnawing at you and make you so agitated, and you felt miserable. But I remember they used to say, "Oh yeah, that's because it's working." And I remember when I came to America, and I was going to school learning all this stuff, and I'm like, oh my God, that was when we were having an allergic reaction. It was it was working. So no, 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 no. If you have like severe itching and scratching where you like scratching your skin off and all that, that is not because it's working. That's because you're having a severe allergic reaction. Please stop and call your doctor's office. Okay. Alrighty. Again, like I said, a serious one where to see therefore you have an infection in your stool, because when you start having that infection and you find yourself going a lot more, and there's a really strange odor to your stool and all that, again, that's an infection, and you can literally become so dehydrated where it may affect your kidneys and all that. So you may need additional medication, maybe a little pill, additional antibiotic with the pill, or you may need to go to the hospital where they have to put you on IV antibiotics. Alrighty. And severe allergic reaction, you find your throat itching and all that, and you find it difficulty breathing, or you break out in severe rash, like look up Steven Johnson syndrome and all. Okay, severe rash where it's like you need to be in the emergency room as soon as possible. Alrighty. So don't not even play, especially like I said, itching your throat, difficulty breathing, call 911, get to the hospital as soon as possible. Alrighty. And then also, like again, like I said, if you're developing and resistant, okay, you're taking a medication that your body is not working, and you develop a resistance to that antibiotic, and we have to change antibiotics around. That's also important why you don't share your medication as well. Okay, so please take it like you're supposed to take it and complete it, even if you're feeling better, because you have to run the entire course of the antibiotic. Alrighty. And somebody might say, but wait a second, so why you giving me something that's going to make me feel better, or it could possibly kill me, or give me like a really bad rash, or all these different things? The benefits outweigh the risk. Okay, of course, we're going to say, okay, do you need this anybody for a longer period of time? Do you need for this and all that? Because we can say like 7 to 10 days, 10 to 14 days, those in between there, we might, we use our own discretion to say you're within the range of time you're supposed to take it. So it's important. And like I said, minor side effects and all, we can treat that. Anything more serious than that, of course. And sometimes you don't know, some people say, okay, yeah, I'm allergic to the rash. And also that's important. You want to tell your doc, okay, I took this before. Do you remember what it's taking? Always remember the antibiotic that you took before that you had problem with. So when you go back, you can give us the name and some medications. Antibiotics come in like a group and all that, so we know what you're taking. So let's say if we give you a medication and you be like, oh, we're going to be asking for your allergies and all that too. And sometimes you have no allergies to the medication, and then you develop an allergy after taking that medication. And you always want to make sure, if you develop an allergy reaction to that, and next time you go to the doctor's office, or you happen to be in a hospital, or you change doctors and all, write that down and make sure they update your allergy profile every time you go to the doctor's office, even your regular doctor's office. Because again, like I said, we do medication reconciliation where we check with everything and we try to update everything. So make sure that it's updated every time you go to a health facility. Okay. Okay, so why shouldn't you take medication, antibiotics that are meant for you? Okay, so you may not need it. Let's say you're taking. You say somebody be like, oh yeah, my friend had this medication, and I'm just going to take it because we kind of had a similar and stuff. Again, like I said, it could be a viral infection, so you may not need it. So don't take it. I talked about the side effects and all that. So you want to if you don't need to go through the side effects, why take a medication that you don't need? Okay, and risk those side effects. All right. You may need a different antibiotic also, because let's say you came to the hospital or you came to the doctor's office. You say, every time I go to the bathroom, I'm burning and it burns. And sometimes the odor is really strong. And so we might do a urine culture. Please excuse the noise in the background. Might do a urine culture. So, and we did a urine analysis. So, okay, we see that. And so it's some kind of, you have a urinary tract infection, but we'll also wait for the culture part. So the part that checks us to see what it is that you're sensitive to. So let's say if we give you this, we treat you. Sometimes we might treat you and say, okay, yes, whatever come back, we might change the antibiotic based on your presenting symptoms. Again, based on your individual history. Alrighty. But we might be waiting for the culture to come back. So what if you're taking something that is resistant to the medication, to the bacteria bacteria that's in your urine, then you're running the risk of like taking something that you don't need. Also, again, putting yourself at risk of developing side effects or resistance to the medication. So it's important that you don't do that. Okay, I know sometimes it's very tempting and I know sometimes it's inexpensive, but don't do that. All right. You could be endangering your own health. Again, like I said, the medication you're taking, every medication you're taking, we have to weigh it against the other medications that you're taking. You may be taking a medication that somebody gives you, an antibiotic that interacts with the other medication that you're taking, that can be very dangerous to, that can land you in the hospital. And sometimes, like I said, anything that could lead to something that completely change your life and livelihood. So it's important. I'm not trying to scare anybody here. Even when you're taking any medication, we look through all the medications that we're prescribing for you. We make sure that it's not interacting with anything else. So if you're taking an antibiotic that is not prescribed for you, we will know. And you go to the hospital and say, wait a second, were you taking this? Who prescribed this for you? Didn't know. Meanwhile, you're taking something that was not prescribed for you. All right. And then sometimes, again, like you said, somebody might leave a medication, maybe your husband or wife or children or something like that. Please don't do this with children, especially with children. Do not do that. It's so important that you don't do that. Alrighty. You say, okay, I'm just going to take the rest of the medication that you're taking because I think I have the same infection. But then that means that person took that medication for maybe 7 days and 7 to 10 days, and let's say they have some more left over or something like that, and you go take it. So that you didn't take yours for like 7 to 10 days. You probably took it for like maybe 3 or 4, whatever, how much was left over. That means you still have this infection in your body, and you could be developing a super infection, meaning because that illness did not heal up, and your body build up resistance, and now you like have to go through all this whole thing again. But then we have to choose between which other medication we're going to prescribe for you because you've developed this super infection and made yourself really sick. All right. Again, medications can be very expensive and not everybody can afford it, but it's important that you do not do that because you're putting yourself at risk. Okay. Alrighty. So you can also ask and say, okay, what are some of the ways I can feel better? And so let's say you'd be like, okay, I don't need an antibiotic, and you're telling me I don't need an antibiotic. So then what? I'm just going to go home and sit there and be raw sick and all that. And your doctor will tell you, okay, these are some of the ways that you can do. So these things you can do, like over the counter medications. Like I said, yes, you can get it over the counter medication for cough. You can get it for like a chest cold, or you can get it again back home. We had Donagrees, we had put out Vicks all over. Remember, I need to put it on your nose, on your arm, rub it on your back, put it in your mouth. I never understood that, but so whatever made you feel good, drink some nice pepper soup and all that really hot peppers. They also have the healing qualities in there. If drink a lot of fluids, get a lot of rest and all, but you do not need antibiotics, okay? Because it's not like I say the person doesn't want to give you antibiotics, and every other doctor gave you antibiotics before. You do not need antibiotics for that. Okay, so we'll discuss with you. All right. And then last but not least, let me see your preventive care. So you want to do your best to stay healthy and keep your other people healthy as well. Alrighty. So of course you want to wash your hands as much as possible. I do have a video. I have to make another updated video on how you're supposed to wash your hands to make sure your hands clean. Proper hand washing is what we do in the healthcare. And also you want to do that in places where you don't have running water and all. I know they used to have like the little bucket during Ebola time where they had, not saying there's not running water there, but I'm just saying places where there are the places where they don't have running water. So you have the bucket here and you have the faucet. I hope people still have that, and you have at least the water's running and you're washing your hands. And other places too, when you're out where you can't go wash your hands, you can use the hand sanitizer. But if you use this hand sanitizer a couple of times, you want to make sure you go back and wash your hands eventually. Don't just use it all day, because when you do wash your hands with it, after you use the hand sanitizer, like most of the time, you can see how much dirt's in there. So if you're using a hand sanitizer, of course you want to do that. Go in there and then make sure your hand sanitizer has not expired, because most of them kind of expired after about 2 years. I know they're kind of updating it now, but make sure this hasn't been expired already. And cover your mouth and your nose when you're coughing or sneezing, making sure you're coughing in your arm like that. Don't do this, because if you're coughing in here, chances are more than likely you're not going to be washing your hands after that. You're going to be touching all the different surfaces or touching another person and then passing that illness to them too, because if they're especially like getting sick and all right. And stay home when you're sick. It's not always possible because some people have to work and they have to take care of their families and friends and all that. Take care of yourself as well. So, but it's always important to stay home, especially when you're like really, really sick. It's good to stay home because you're not going to be any good to yourself when you're driving, especially if you're sick where you developing a fever or getting a little dizzy. If that's the case, please go to the emergency room anyways. But stay home, get enough rest, get some, get some nice TLC for your family member, and stay home until you get better. Okay. And also avoid touching your eyes and nose and unwashed hands. I see people doing this when they rub their eyes, or they're touching their face and their hands and their mouth, or they just reach over, and it's like, no, don't do that. Keep your hands away from your face as much as possible. If you're going to have to scratch your eyes, you can always do the back of your hands like that. Alrighty. And as much as possible, have a hand sanitizer. I have hand sanitizer in my bag. I have one in my car. Have one, of course, I have it where I work and all that. So make sure you're using that as much as possible. Drink, exercise, eat healthy, all that too, because you're building up, you need your body to be strong. So when you're having a viral infection, a bacterial infection, even if you didn't need antibiotics, even if you didn't need it, meaning you still have to eat healthy, you still have to do things and all that too, so the body can kind of rest, recover, and all that too, and be able to fight out. So you want to get up. If you're sick, get up as much as possible, move around, even if it's one every hour, move around, move your feet around and all that, so you get your blood circulating so you're not there. And again, most important thing, like I said, make sure avoid contact with people who have colds and other upper respiratory infection. Of course, again, stay away from people. And if you don't have to go out, I know during COVID time, it's like stay home, isolation and all, but you can stay home. Alrighty, just stay home, put your mask on. And sometimes you can wear your mask too, even if you're going to it doesn't necessarily have to be just for COVID. All right. So do that and stay healthy. And again, get the flu vaccine if you have to get the flu vaccine. Also get the COVID vaccine if you have to get a COVID vaccine, and other vaccines are for age appropriate and all that. If you're a child, if you have a children, make sure you're talking to the pediatrician and all the many ways to keep them safe and healthy, because the little ones just come with so many things. They touch each other backs, they touch their hair, they touch their mouth, they touch anything. And especially when they're in daycare or like elementary school year, they just come. It's like they're sick every other week. They're sick because as soon as they get sick and get well, another classmate is sick and get well, and so they're coming back and forth. So they're resistance, and then they make you sick. So every time you're sick too. So when they're at that young, it's most important making sure you're wiping down all the surfaces when they come home. Wash their coats most of the time, at least every week. If it can't be washed, just wipe it down, kind of put it in the dryer for it to, the heat will kind of kill some of the bacteria and viruses and everything that's on there. Okay. So do your best to be healthy. And the most important thing is, if you don't need antibiotic, your doctor's not going to prescribe it for you. And if you do need antibiotics, make sure you take it exactly the way it's prescribed. Finish it, finish it, finish it. Do not take any antibiotics that is not meant for you, that was not prescribed for you. If you have any side effects and all, bring that to your doctor's attention. And also keep your allergy profile updated as much as possible. Okay, so leave your comments and questions below in the comments section, and I'll be available to answer them. Thank you all for watching. Thank you all for all your love and support, and I will talk to you guys later. So you stay healthy and stay happy and stay safe. Okay, I will see you guys. And as often, also, if you have not liked and followed Abby Tyler's Healthy Living page, I am on Facebook and I'm also on YouTube, and I stream to Focus on Liberia. So thank you very much and good night.